Hi everyone, and very good evening to all of you. For those who have joined me live for this special session for the FMG discussion, what I planned is in this entire session, I'll be discussing all the questions right from 2021 onwards. Let's see how many questions we can solve, and we'll not go into a lot of details of those, but surely discuss all the important things about the options that we need to know before the exam. For those who are watching this live, I would also request and advise you to be maximum interactive. I am very sure that you will really love the session. And in case of any issues with any questions, any options, do let me know on the live session as well on the chat box, so that I can also discuss the any same issues with you. So I hope that my audio and video is very clear. Hi Vinayak, Phoenix, Shahrukh, Asha, and Aman. Hi, good evening, everyone. And I'm very sure that you might have all been looking forward for the session, because this is mostly about those questions which are usually asked in a FMG exam. A lot of questions from the last 3 years have been very clinical oriented also. So if I have the proper discussion of pathology questions, I can very be confident that we can also solve a lot of questions of medicine, surgery, gynae ops, and pediatrics as well. So guys, if you're all fine, let's start it. Hi dear, hi Abhinandan and Karthikeyan. Yes, is my audio and video clear to all of you? And if it's okay, then let's start the session. Hi, good evening, Smart Surgeon, Abhinandan, Phoenix, Ritesh. चलो great. So पहला क्वेश्चन स्टार्ट करते हैं. चलो तो देखो, I'll not read the question for you. I want all of you to look at this question and tell me what do you think is the answer. Yeah, so this question is on hyper segmented neutrophils, and which is basically a property of this is a hyper segmented. Okay, it's a hyper segmented neutrophil, which is basically a property of megaloblastic anemia. So now the question is, which of them can cause megaloblastic anemia? It can be both B12 and folic acid, but look at the problem. They basically are showing you neurological deficits, right? And so because this unique statement they have given in the question, the answer has to be a B12 deficiency. Great. Okay. Acha, thalassemia and IDA will not show you this finding, but the thalassemia will show you micro and hypo. Both of these two will show micro hypo, even though folate deficiency can also show you the macrocytic RBCs, and can also show you the hypersegmentation, but will not show you the neurological deficit. So this is a striking point in this question. Okay, chalo. This question, guys. The following is a correct description of the type of the heart lesion in rheumatic arthritis. Batao, what is the answer to this question? Yes, typical rheumatic arthritis is showing you fibrosis of the valve leaflets. Okay, अब देखो, what is osler node? Osler node, remember, ouch, it's a painful. So this is basically a painful or a tender nodule on the fingers. Now my question to you is this a inflammatory episode, or is it a vascular episode? So what type of phenomenon it is, vascular or immunological? So it is a very good, it's a immunological phenomenon. It's not a vascular phenomenon, it's an immunological phenomenon. Whereas McCallum's patches, I should say, this is the best word is patches. The McCallum patch, that's a painless ischemic patch. So the moment I say ischemic patch, it becomes surely a case of vascular phenomenon. Acha, floppy valve kya hota hai? Anyone you know what is floppy valve? Floppy valve basically is a mitral valve prolapse and has nothing to do with the rheumatic arthritis. Rheumatic arthritis initially show mitral regurgitation, and the chronic causes will lead to mitral stenosis, but will not show you any type of floppy valve in the case of rheumatic arthritis. Okay. Next question. Look at the question. So 53-year-old patient has a known case of hypertension and type 2 diabetes with a complaints of fever, cough, and breathlessness. The BP is 140/85, pulse 98, temperature 98, and SpO2 92. On chest radiograph, no significant findings are seen. And now the question is having the patient has moderate COVID-19 infection also. So do you remember what is the main cause of the lung injury in COVID-19? Yaad hai? What is the main cause of lung injury? Yes, the answer is ARDS, correct. So the basic problem was ARDS, and which of the following options suggest you ARDS? The answer is, it is Diffuse allo damage. Well done, perfectly answered by Ritesh, Vinayak, Mehran, Gopika. अरे सब लोग आंसर करो यार, 40 लोग, 40 students watching it live. So yes, hi Shejwan. Yes, ARDS, cytokine storm, very good. So this is a basic finding here, and this can also be linked with the HMD. HMD क्या होता है? Hyaline membrane disease. Just to go into the fact, COVID-19 infection was through the type 2 pneumocytes. Okay, they enter type 2 pneumocytes, and then the COVID-19 destroys type 2 pneumocytes. But do remember, in ARDS, the main injury occurs of endothelial cells and type 1 pneumocytes. So don't forget this. COVID-19 enters through type 2 cells and destroys type 2 cells. But do remember, in a typical case of ARDS, the type 1 cell is damaged, type 2 cell is intact. COVID-19 में क्या हुआ? Type 1 is also gone, type 2 is also gone. That was the problem in COVID infections. ठीक है, all of you? चलो. अच्छा, electron microscopic image has been shown here with the rolling of the leukocytes on the endothelial cells. So which proteins are involved here? बताओ फटाफट. What is happening here? It's a rolling. So for rolling, what do we require? We require selectins. अच्छा बताओ, integrins are involved in adhesion. Okay, transferrin is not involved in that part. Transferrin is not involved in that part. And PCAM, actually, PCAM also referred to as C31, that is involved in transmigration, also referred to as diapedesis. That is what is PCAM involved for. Okay, that's, I think this is very correctly answered. Selectin is mainly involved in the process of margination, and to some extent it's also involved in the process of rolling. The two things in which is involved in. Okay, so this is, I think all of you are comfortable with answering this question as well. Okay, chalo, let's go to the question number 5 now. Chalo, which type of anemia is seen in patients who are having rheumatic arthritis? ये क्या क्या solve किया बताओ. So rheumatoid arthritis basically is a chronic inflammation, right? Since it's a chronic inflammation, so क्या होगा इसमें? Yes, it should be normocytic normochromic RBC as a more common cause than microcytic hypochromic RBC. Sir, how it is possible? We have read that ACD में is microhypo RBC, but do remember, even though the chronic inflammation में there is a normo more common than microhypo, and so here the better answer is normo and not microhypo. समझ रहे हो? Had the question been on iron deficiency anemia, then I would have chosen microcytic anemia. ठीक है, but since RA is a ACD, so better answer is normo more common than microcytic hypochromic RBCs. ठीक है, सबको क्लियर है? For those who are answering it A, I think I could make it clear. ठीक है ना? सब कोई दिक्कत तो नहीं है? चलो, वेरी गुड. अच्छा, लिक्विफैक्टिव नेक्रोसिस इन विच ऑफ द फॉलोइंग इन्फेक्शंस बताओ. लिक्विफैक्टिव किस में होगा? इश्कीमिया 2, CNS, perfectly answered. Yes, cerebrum. So cerebrum will undergo liquid necrosis, and all other beings or organ will undergo coagulative necrosis. So what are the other examples of liquid necrosis? Apart from ischemia to CNS, it also occurs in wet gangrene. It can also occur in any type of coagulative necrosis plus a bacteria infection. Any type of coagulative necrosis plus a bacteria infection will also undergo a liquefactive necrosis. ठीक है, so here the answer is C. Very correctly answered. Yes, answer is C. ठीक है. 7th, the following is a correct sequence of the early erythropoiesis in development fetus. Sequence बताना है, बताओ. हाँ, pancreas, very correctly answered. Ptolemy, very correctly answered. Pancreas can also undergo a liquid necrosis. So fatty necrosis is also type of liquid necrosis. Very good answer. चलो, अभी बताओ. First is yolk sac, then liver, and then bone marrow. Perfectly answered. Very good. B. So देखो, now the question that I can ask you is that when we talk about the bone marrow, so bone marrow at birth, it is all bones, but only during the puberty. In the puberty, it becomes a flat bone. So puberty onwards, it becomes flat bones, but at birth, it is only the long all bones that often lead to this type of production. ठीक है? चलो, हाय उत्कल, हाय उत्कर्ष, हाय, गुड इवनिंग टू यू गाइस. ये बताओ, a 47-year-old woman complained of abnormal uterine bleeding for the past 2 days. On blood workup, she was found to have anemic. So now the question is, she is having uterine bleeding, and the question is anemia in non-pregnant females. What is WHO cutoff? बड़ा simple है, 13, 12 and 11 ग्राम परसेंटेज. ठीक है. अच्छा, 13 in males, 12 in non-pregnant females, obviously non-pregnant females ही बताऊंगा, and in pregnancy it's a 11 gram DL. So here is non-pregnant पूछा है, तो what is the cutoff? Cutoff is 12. Okay, cutoff is 12 here. D, very good. So 11 तो anemic हो जाएगा ना, cutoff is 12. The moment below 12 it's anemic. ठीक है. चलो, next one. The following test is the most sensitive and specific test during antenatal checkup for a pregnant lady with a family history of thalassemia. क्या पूछा है? Sensitive and specific. बताओ. Yes, Ritesh. 13 मेल में, 12 फीमेल में. वेरी गुड. इसका आंसर बताओ. Yes, HPLC. Now the question what they can ask you is about the beta thalassemia. They can ask you about the minor and they can ask you about major. ठीक है. So in these two cases, they can ask you about the beta thalassemia trait में क्या होगा, and sorry, what will happen to the various type of hemoglobin of percent of HbA, of A2 and F. Do you remember, if the question is minor, then it is A is decreased, A2 is okay, A2 is increased, F remains normal. But the moment it becomes beta thalassemia major, तब क्या होता है? A is very low, A2 is increased and F also is very high. This is a simple way to differentiate a thalassemia. If the question would have been what is a screening test, this would have been the answer. If the question would have been what is the next test, the answer would have been peripheral smear and a tick count. If the question would have a sensitive specific but the HPLC is not in the option, in that case HPLC nowadays better option than electrophoresis. ठीक है, as answer for screening a case of thalassemia. Yes, high HbA2. very good. Sriharini, very good. And yes, Ritesh. ठीक है. चलो, the following is the most common tumor associated with superior vena cava syndrome. बताओ, which of them is superior vena cava के साथ कौन कौन है? Compression of superior vena cava. So yes, it's a lung cancer. Okay, and basically it is usually a non-small cell cancer, and small cell cancer which can cause this. Small cell cancer often leads to superior vena cava syndrome, more common than the non-small cell cancer. ठीक है. 11th. So all newborns are given vitamin K as a part of newborn care. With the following is a blood coagulation cascade vitamin K is required. बताओ. हाँ, yeah, globin sequencing is the best one, then HPLC and then electrophoresis. Perfectly answered. Great. इसका बताओ बेटा. Yeah, beta नहीं, gamma carboxylation होता है, not beta, right? It's a gamma carboxylation of which one? Yes, glutamic acid of 2, 7, 9 and 10. So the answer is D. The best answer is 2, 7, 9 and 10. So what happens? देखो, if you talk about 2, 7, 9 and 10, they are all inactive initially. Now to activate them, the site is liver, and with the help with the help of vitamin K, what happens? There is a gamma carboxylation. The moment there's a gamma carboxylation of the glutamic acid, now the active factors comes out. Do you remember? This whole thing can be inhibited by a oral anticoagulant called as warfarin. So if they ask you, is there any other thing which is vitamin K dependent factors apart from 2, 7, 9 and 10? Yes, it's protein C and protein S also are the vitamin K dependent factors. ठीक है? So this is a question number 11. Right now we're discussing FMG recall of 2021. After that we'll discuss 2022, 23, 24. सब कुछ discuss करना है. चलो, all of you. Which the following has maximum smooth muscle as compared to the wall thickness? Maximum smooth muscle. बताओ क्या होगा? Yes, देखो. The simple sequence is B, then T, then R, and then S. मतलब bronchiole, terminal bronchiole will then open into respiratory bronchiole, will then open via the duct into sac. ऐसे. So now the question is, which of them has maximum smooth muscle? To remember, as you go from the bronchioles to respiratory, this one, there is a decrease in the smooth muscle. That means if the question is maximum smooth muscle, the answer has to be a bronchiole, not in the option. Then you choose yes, terminal bronchiole is the next best answer. So remember, it's terminal bronchiole, then is respiratory bronchiole, ultimately least of them is in sac. Had the question been also with the bronchiole, that would have the best answer and has the maximum smooth muscle. But here, in not in the absence of bronchiole, I am choosing terminal bronchiole as the second best answer. ठीक है? अच्छा, क्या पूछ रहे हो इंडियन कम्युनिटी? सर, देयर वाज अ क्वेश्चन रिगार्डिंग विच वन विल बी directed raised earliest in vitamin K. So earliest होगा prothrombin time and among them 7. So 7 factor 7 decreases first and so PT increases first. I think this answers your question. Shahid, I think this should be sufficient because discussing. Yeah, it was a small lag, guys. Sorry for the lag. There was some lag, but now it's okay and fine. आगे बढ़ते हैं. So देखो, this is a potent and reactive का answer is hydroxyl. And had the question been what is the most efficient free radical? Okay, most efficient free radical. The answer is OCl dot minus. Okay, had the question, if the question is which of them lead to oxygen or respiratory burst activity, oxygen oblique respiratory burst activity, then the answer to that question is a NADPH oxidase. We can also call this phagocytic oxidase, and this enzyme in fact is the most important enzyme in inflammation, because if this enzyme is not there, none of the free radicals produced. And I hope you remember that this is the one which helps in changing oxygen to superoxide. So there are three questions which can be asked in the free radicals. I want all of you to remember and write it down in your notes. These three exam questions can be asked. ठीक है? चलो. The following is a negative acute phase reactant. देख ध्यान रखना that positive and negative APR. Okay. If the question is a positive APR, your answer can be a ferritin. Your answer can be haptoglobin, ceruloplasmin. Okay, ferritin. नहीं, मोस्ट पोटेंट ओ सेल डॉट माइनस नहीं है नायन, ठीक है ना. मोस्ट पोटेंट इज हाइड्रोक्सिल, मोस्ट एफिशिएंट इज हाइपोक्लाइट आयन. तो जो मैंने लिखा है ये पक्का है ना, एकदम इसको चेंज नहीं करने का. ठीक है, बोलो ओके, बोल दो भाई. चलो, हैप्टोग्लोबिन, सेलप्लाज्मिन, मैं लिख रहा हूँ पॉजिटिव एपीआर एंड नेगेटिव एपीआर, इसको लिखता क्लियरली यहाँ पर. सो देयर इज अ पॉजिटिव एपीआर फेरेटिन, हैप्टोग्लोबिन, देयर इज सेल्युलर प्लाज्मिन. Apart from this, it can also be the fibrinogen, okay, CRP, and it can also be the serum amyloid. So these are the positive APR. Just remember, because of the increase of ferritin, this decrease of transferrin. So often transferrin becomes a negative APR. Second, albumin is also a negative APR, and one more is transthyretin. This also is a negative APR. So among all the options you see here, all the options, negative APR is what? Ferritin is positive, this is positive, this is positive, albumin is a negative APR. ठीक है? चलो, identify the mode of inheritance. फटाफट बताओ, what is the answer to this question? Mode of inheritance. A unique one. It's a very unique mode of inheritance that is asked here. Think you'll get the answer. Common sense लगाओ, common sense लगाओ. I want all of you to answer this question. हाँ वाई तो है, वाई में दो है ना, डोमिनेंट रेसेसिव है. थिंक यू आर सेइंग एक्सटिंक्ट रेसेसिव. ओके, सो देखो इफ इट इज एक्सटिंक्ट रेसेसिव क्या होना चाहिए. नाउ यू आर सेइंग वाई लिंक डोमिनेंट. देखो रूल ऑफ डोमिनेंस क्या कहता है. रूल ऑफ डोमिनेंस सेज दैट इफ अ चाइल्ड इज डिजीज वन ऑफ द पेरेंट्स शुड बी डिजीज्ड. सो हियर इज नॉट देयर, तो यू शुड नॉट मार्क दिस वन एंड दिस वन. तो नाउ द क्वेश्चन इज वायलेंट रेसेसिव और एक्सटिंक्ट रेसेसिव. अब बताओ. Ah, you think A and you are right. It's a very unique question. Its answer is A. देखो, why it is not extinct recessive? Because if this would be an extinct recessive, then from the male would go to the females, and this male would get diseased if she is basically a carrier, right? In that case, the male can be diseased. But what is happening every time is that the male is only having a disease. Female is not having a disease at all. Well, that can be answer, and so the answer is Y-linked recessive. That's a very unique question, but this can also be asked. ठीक है ना? So just you make sure that you understand this. Extinct recessive लग रहा है, but extinct recessive is not extinct recessive because in that case the males would also be involved in some of the other pedigrees will also be involved here. हाँ, skipping है तभी तो recessive है ना. If they would not have been skipping, then it would have been dominant because skipping है and hence it is recessive. But anyway, you can't say skipping also because this is also not involved, this is also not involved. Only the males are getting involved here. ठीक है. So very unique question, I'll say. Not a very easy one to crack also. So it can be extinct recessive also. But in the event they're asking you only the males are getting in disease, only males are getting diseased here. And that too, you see, these are all normal, but still they're getting diseased. And so it might be a Y-linked recessive. So very unique one, not a very good one pedigree also, but was asked, so I was just sort of discussing it with you. Chalo, inhibition of phosphorylation of the RB gene will have the following effects on the cell cycle. Yes, very weird question, very true. Chalo, ye batao, answer. So yes, it says you that RB is like this, and with the RB you also know that E2F is often attached, right? What happens now? The RB often adds a phosphate group to it, and because of phosphate group, what happens? The E2F becomes free. Okay? Now the E2F will become free. Once the E2F becomes free, now it will cause G1S more than G2M activation. So in this case, what is this telling you is if this is not happening, then the RB remains here, and so this would stop. The cell cycle will stop at G1S more than the G2M. So the better answer is A. Inhibition cell cycle at G1S and a better answer than G2M. ठीक है. So this is the first one. We now move to the December 2021 questions of the FMG. ठीक है. I hope you all are running fine. बढ़ते हैं to the first one. A man present with fever, altered albumin and globulin ratio, and urine protein shows X-ray with multiple lytic lesions. क्या हुआ? His answer is multiple myeloma. Why? देखो, fever है, altered albumin globulin ratio. Why it will happen? Because in multiple myeloma, you all know there's a M spike. M spike क्या होता है? It's an increase in the gamma chain. Gamma chain क्यों? Because it's an antibody, and so it becomes altered. Urine protein होगा. Which protein? It's a Benz-Jones protein. Very correct. है ना? This would be Benz-Jones protein. There's a multiple lytic lesions in skull. So all of them fits into the topic of multiple myeloma. Okay. In this, what will the Paget disease show? Paget disease is often initially, right, is initially osteolytic, then there is osteoblastic phase, and finally there is a mixed sclerotic phase. The three phases in the Paget disease of the bone, पहले होगा osteolytic, फिर होगा blastic, and then there is a mixed sclerotic phase to find the answer of Paget disease of the bone. ठीक है. हाँ, Paget disease breast भी होता है, but that's a different entity altogether. That's a Castleman C2, but this is actually a Paget disease of the bone actually. ठीक है. अच्छा, gene mutation in hemochromatosis, हाँ सिंपल है, HFE. तो क्वेश्चन कैन बी व्हाट डज HFE डू. HFE का फंक्शन होता है द HFE ऑफन it decreases the release, mutation है ना, decrease the release of haptoglobin. So if haptoglobin decreases, it will increase the amount of which one? Yes, ferroportin. And because of high ferroportin, you all remember there is a increased iron absorption. Okay? They can ask you what is the best test for diagnosing this. The best investigation is the liver biopsy. In liver biopsy, you have to do the iron estimation. Iron estimation in the liver biopsy. And how can you do iron estimation? By staining it by the Prussian blue or the pearl stain. Also remember in this one, ATP7B, this is often absent Wilson disease, and this surely is the alpha 1 antitrypsin deficiency. We surely the answer there. Okay. Chalo. The following tumor arises from all the three germ layers. Yes, a simple one, but I'll answer batao fatafat, all of you. You are answering this less, dear. Thoda all answer karo na. All of you should answer the question. Kya hoga iska answer? Yes, it should be teratoma. Achha, what they can ask you elsewise? They can ask you the tumor marker. For seminoma, the tumor marker is PLAP and LDH. Remember, beta HCG जो है वो प्लस माइनस होता है. Yolk sac tumor में the main marker is alpha 1 antitrypsin and can be alpha feature protein. Achha, cholestoma is just not a actually tumor which can lead to this type of tumor markers. So they have other question they can ask you in this case. Okay? Chalo, next one. A 65-year-old male presents to the OPD with fever and weight loss, fatigueness and pallor. Now CBC is giving you a hemoglobin of 9, raised TLC है, myeloid cell less than 9% and basophil is 4%. क्या हो गया इसको? Raised TLC with basophilia. This is myeloid cell but less than 9%. Yes, it can be CML. Very good. So this whole story can be a case of CML because this basophilia is there. Surely it cannot be CLL, and the answer is 922. Okay, and in this the question can be which mutation? It's a PH chromosome mutation. And what is the most common protein? P190 नहीं होगा, P210 is the most common protein here. P190 is in ALL and P230 is often seen with neutrophilia, which is associated in a case of CML. Okay, so this answer is surely a case of CML. Okay, चलो. Infraclavicular lesion of TB. बताओ क्या कहते हैं? All of you. What is this lesion called? Infraclavicular. हाँ, there's a most common mutation in this case is the PH chromosome of 922. इसका आंसर बताओ, इसका आंसर. So I'll give you a very important information, guys. ये देखो. In a pulmonary tuberculosis, it can be primary TB, which shows a Gons focus and shows the Gons complex. Gons focus is a primary site of infection, and along with the primary infection, if you see the lymph node also, it becomes a Gons complex. And these two are seen in primary tuberculosis. Post-primary TB, also referred to as dissemination. In the early dissemination, it can lead to Simmons focus. In Simmons focus, it's a lung apical lesion and can show you miliary tuberculosis. But in the late dissemination, it can lead to a post lesion and Asman focus. ये दोनों क्या होता है? Post lesion is a coarse granular dissemination and Asman focus is a infraclavicular consolidation. ठीक है? So because the answer is infraclavicular lesion, इसका answer will not be Gons focus. ठीक है? Infraclavicular lesion है ना, and hence the answer is Asman's focus. समझ आया सबको? इसको याद रखना. देखो, पुल लीजन क्या है? कोर्स ग्रानुलर डिसेमिनेशन. Asman क्या है? Infraclavicular consolidation. और Simmons क्या है? It's a solitary TB focus at the lung apex. ये तीन नाम होते हैं in the tuberculosis. So will you all remember this? All of you tell me, promise me. ये भूलोगे नहीं. Okay? Pull lesion is a coarse granular spread. Okay? Gons focus is the primary infection site. And along with this, if there is a lymph node also, it becomes Gons complex. ठीक है, चलो ग्रेट। अर्लीस्ट सेल इन्वॉल्व इन इन्फ्लामेशन अमंग द फॉलोइंग, बताओ हु इज अर्लीस्ट सेल? कॉन्स फोकस सब कुछ दिखता है टीबी में, ऑल ऑफ देम आर सीन टीबी ओनली। फर्स्ट सेल इज न्यूट्रोफिल, वेरी गुड, there's no other thing, but just remember one thing, that in chronic infection neutrophilia is seen in chronic pseudomonas infection. So in chronic pseudomonas infection often the patients show neutrophilia. Okay, चलो, the following can lead to skid, बताओ क्या होगा आंसर? देखो, the most common mutation of skid is, most commonly क्या होता है? It's interleukin receptor mutations, but not in the option. Yes, the answer is ADA. Very good. ADA deficiency, it's X-linked recessive more than autosomal recessive disease. In fact, X-linked is the interleukin receptor mutation and ADA is an autosomal recessive mutation. So this will cause a loss of decrease of B cells, T cell, NK cell, all of them are lost in a disease called as severe combined immunodeficiency. Okay. Defect of tyrosine kinase, it often leads to Bruton's tyrosine kinase deficiency, and that is often a decreased amount of all antibodies including the B cells. So this also is lost in a case of the tyrosine kinase. क्या कंफ्यूजन बताओ स्किड में? SACD, SACD तो सब, ओके 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 अच्छा अच्छा, सब एक्यूट कंबाइंड डिजेशन का तुम मान रहे हो बीटा डेफिशिएंसी। ओके, नहीं, यू शुड रीड द क्वेश्चन वेरी वेल डियर, ऐसे मत करो, एग्जाम इज वेरी नियर, रीड द क्वेश्चन वेरी वेल, बट होता है, बट एंश्योर यू डोंट डू दिस अगेन, ठीक है? ओके, फिनेक्स, चलो, अटैचमेंट ऑफ WBC टू द एंडोथेलियल सेल इज ड्यू टू, बताओ। यस, इट इज इंटीग्रिन। देखो, among leukotriene, what they can ask you leukotriene में, they can ask you LT, B4, C4 and D4 का फंक्शन। LT B4 is a chemokine, ठीक है? C4 and D4, the C4 and D4, these two often are acting like histamine. So when I say histamine, I mean the function can be vasodilation, increased permeability and bronchoconstriction. In fact, this is the most common bronchoconstriction, ठीक है? अच्छा, now look at this one. Prostaglandins, it is PG, D2, E2, F2. So D2 का function is same as histamine. Okay, E2 causes fever plus pain during inflammation, and PGF2 leads to vasoconstriction. Vasoconstriction. हाँ, आओ, stands before me. वाह, very good, very good. चलो. Now we move to the June 2022 questions. All ready? चलो. A known diabetic patient came to hospital with a pigmentation skin over the arms. There's also micronuclear cirrhosis. क्या हो गया इसको? What has happened? Yes, hemochromatosis हो गया. Very good. The answer is hemochromatosis. Okay. So this will show you what? In the liver will show you PAS positive diastase resistant globules is seen here. ठीक है? What do you see in Wilson disease? It's a copper toxicity. Will show us copper toxicity. ठीक है? चलो, आज देखो कौन आया हमारे क्लास में। एक नया स्टूडेंट आया है। इस स्टूडेंट को सब लोग हेलो बोलो। हाँ, एक नया स्टूडेंट आया हमारे क्लास में, इस स्टूडेंट को हेलो हेलो बोलो। इस स्टूडेंट का नाम है डॉक्टर अश्विनी कुमार। हाँ, और इस AI हेल्प AI हेल्प मेरा बनाया हुआ डिजीज़ है, ये कोई डिजीज़ नहीं होता, इसको भूल जाओ। अच्छा अश्विनी सर, ये बताओ, ये क्वेश्चन आपसे नहीं पूछूंगा, थोड़ा सा आपको लगेगा सर क्या पूछ रहा है, आप मेरे लिए आंसर दो। हाँ, ये आंसर दो अश्विनी सर, ये आंसर आप दो, हिंट दे दूंगा आपको। ये बताओ, ये इसका आंसर बताओ सर। टेस्ट नॉट डन ड्यूरिंग ब्लड ट्रांसफ्यूजन। गूगल करके आंसर बता सकते हो, आपके लिए अलाउड है। अच्छा, हेप ए इज नॉट डन इन केस ऑफ ब्लड ट्रांसफ्यूजन, ठीक है। So HIV 1 and 2, HBV, HCV, malaria, and syphilis are the few of them which can be tested during blood transfusion. Remember, क्या क्या टेस्ट करते हैं? HIV 1 and 2, HBV, HCV, malaria, and syphilis. These are the 5 things that we can test in case of that transfusion. Others we can't test. But does it mean only these are actually transmitted? No. Apart from this, do remember that other which can transmit but we don't test it for, those are the Epstein-Barr virus, parvovirus, rubella, and importantly HTLV1, ये मत भूलना, very important. Prions can also transmit a lot of infections, especially bacterial infection can also transmit by the infections. Do remember that we cannot check for these infections because it becomes too much costly, and not only costly because not cost effective also, because the risk of transmission of these 5 diseases are very very low. But these are the all 5 which must be tested for, and I hope you all know that unless these are not negative, we can't donate this blood to someone else. So all of them should be negative there. ठीक है? तो तुम लोग सब लोग को मोटिवेट करने के लिए सर आए हैं, सर की तरफ से कुछ बढ़िया, आई कैन नॉट अभी तो इनवाइट नहीं कर सकता यहाँ पर, बट इफ सर बताओ क्या किया जाए। तरी सर एक बार बताओ कि हाउ शुड द स्टूडेंट्स प्रिपेयर टू गेट क्वालिफिकेशन मार्क्स इन एफएमजी। बड़ा क्लियर कट क्वेश्चन है अभी एफएमजी स्टूडेंट्स का। भाई मेरे को 200 पार नहीं करना, मेरे को 250 260 नहीं लाना है, मेरे को सिर्फ चाहिए 150 और 150 प्लस। बट इंपॉर्टेंटली the pain of getting 147, 148, 149, I don't want to do that, and therefore just do whatever possible in last few days, because these last few days will ensure that if suppose you are at all going to the mark range of 130, 140, these few extra things we give you on every day can push you to that limit in which you can get 150 plus. The moment you get 150 or 150 plus, you are sorted for a whole life in our country. ठीक है, चलो आगे बढ़ते हैं। A 22-year-old multiple history of jaundice, mild HS, and is not very clearly made. I just ignore this question. ठीक है, it's not very clearly made. इसको छोड़ते हैं, यहाँ चलते। The most abundant plasma protein. Tell me what is the answer? बताओ। Most abundant plasma protein. Yes, most abundant is albumin. Okay, albumin. देखो इसका आंसर गिलबर्ट है, बट सिंस इस शॉर्ट फॉर्म यूज किया, जस्ट नॉट पुटिंग इट, आई विल जस्ट टेक इट लेटर ऑन बिकॉज आई हैव बेटर क्वेश्चन फॉर दिस इन द अपकमिंग स्लाइड्स आल्सो. बट दिस surely is the most abundant protein is albumin. Do remember that A/G का रेशियो होता है 1.5:1. So इसका आंसर is A, albumin. Okay. Okay. Myasthenia gravis is what type of hypersensitivity reaction? बताओ। अरे हर्ष मेरा आंसर दो, तुम अभी डेविएट मत हो, बताओ। माइसनिया ग्रेविस टाइप 2, यस। इनफैक्ट देखो टाइप 2 का एग्जांपल कैसे याद रखना है, याद रखना। देखो टाइप 1 में यू नंबर 4A, एस्थमा, एनाफिलैक्सिस, एटोपी एंड देयर इज एलर्जी। डू रिमेंबर अगर क्वेश्चन में है एटोपिक डर्मेटाइटिस, दैट्स अ टाइप 1 हाइपर रिएक्शन। अगर क्वेश्चन में है कॉन्टैक्ट डर्मेटाइटिस, इट बिकम्स अ टाइप 4 hypersensitivity reaction. Just remember this. Type 2 में it can be disease like good pasture, it can be rheumatic arthritis, it can be ANCA vasculitis, and can be also pemphigus. Apart from them जितने भी blood borne हैं जैसे कि ITP है, AIH है, these all are type 2, and surely myasthenia है, Graves है, pernicious anemia है, these are also type 2. Type 3 बड़ा simple याद रखने का. Type 3 is sharp, S is SLE and serum sickness, H is Henoch-Schönlein purpura, A is Arthur's reaction, R is rheumatoid arthritis, and P is polyarthritis nodosa. These all are basically the finding of, these all are basically the disease under type 3 hypertension reaction. Just to ensure you remember that all glomerulonephritis are type 3 except good pasture. Good pasture होता है type 2 hyper sensitivity reaction. About the type 4 में देखो the main examples of apart from granuloma तो हो गई. Apart from granuloma, it is basically the contact dermatitis, multiple sclerosis. It can be Montauk reaction, is very very important, Montauk reaction, and can be lepra reaction type 1. अगर क्वेश्चन में है lepra reaction type 2 तो वो होगा type 3 hyper sensitivity reaction. I think I could revise all of these examples which are important for you for any exams also. ठीक है, ये बताओ. इसका आंसर बताओ. हाँ अरे भाई सर अभी तक लगे हुए हैं, देख लो. सार्कोइडोसिस भी टाइप 4 होगा. हाँ रूल ऑफ टाइप 5 लगा सकते हो फॉर लेप्रा रिएक्शन. वेरी गुड, बहुत अच्छा. अरे इसका आंसर दो सब लोग फटाफट. सेल रिस्पॉन्सिबल ग्राफ्ट रिडक्शन इज yes, it's both B and C. T and B cells both are involved. NK is not involved, but B and C both. अच्छा तुम लोगों ने सिर्फ T cell क्यों मार्क कर रहे हो? Is B cell not involved? क्या बात कर रहे हो? If you're looking at an option of D, जहाँ B and C दोनों है, you can't just answer T cells because do you remember B cells? Why B cells sir? कैसे तुम बोल सकते हो? B cell will make what? Antibody. And don't you know antibody mediated rejection? ये कैसे गड़बड़ कर रहे हो? बेटर आंसर इज डी. अब तुम बोलोगे नाउ यू विल से कि सर मैंने तो डी ऑप्शन देखा ही नहीं. अब तुम बताओ यार. अब टेलिंग यू द पेन ऑफ गेटिंग 147 148 149 ना, दैट पेन इज इमेंस. क्वेश्चन ध्यान से पढ़ो. डू नॉट कम बैक फ्रॉम द एग्जाम हॉल टेलिंग अस कि सर वो क्वेश्चन ध्यान नहीं पड़ा. यार ऐसा मत करो, ठीक है. तो क्या होगा ग्राफ रिडक्शन में? एक है हाइपर एक्यूट, वन इज एक्यूट and one is a chronic rejection. ठीक है. हाइपर एक्यूट में प्री फॉर्म्ड एंटीबॉडी है. दिस इज ड्यू टू अ प्री फॉर्म्ड एंटीबॉडी. दिस इज पोस्ट ट्रांसप्लांट टी सेल हो सकता है और पोस्ट ट्रांसप्लांट एंटीबॉडी हो सकता है. दिस शोरली इज अ टी सेल मीडिएटेड. तो टी सेल बी सेल दोनों हो गया ना, राइट. चलो. अ 10-year-old child came to clinic. Her mother gave a history of repeated blood transfusion over the past. Tell me the answer. I'll just plug in my charger. Please tell me the answer to this question. Yes, the answer is now the patient has been maintaining good rates, but now for past few months her grade deteriorating and remains lethargic. And crescent shape RBC मतलब क्या हो गया इसको? सिकल सेल अनीमिया हो गया. ओके, तो व्हाट टू गिव? यस सिकल सेल अनीमिया लिखा हुआ है ना, क्रेसेंट शेप RBC है, सिकल सेल अनीमिया. तो व्हाट इज द मेन प्रॉब्लम हियर? तो शी हैज कम टू द क्लिनिक because she has repeated blood transfusion over the past. Okay, and now was maintaining good rates, but now she has deteriorating and remains lethargic. क्यों lethargic होता होगा? Because there might be pain. And how to get pain? What should you do right now in next step management? The answer is normal saline. अच्छा क्यों normal saline? Let's understand this. देखो, the patient is already getting repeated blood transfusion, right? And she surely has right now a lethargic condition and she is not able to maintain good rates. Might be because she has pain in the legs, pain in the hand, she's not able to work properly. And remember, when the question is next step in the management of sickle cell anemia, always the answer should be a case of normal saline. If not in the option, then you can also give oxygenation. Blood transfusion is not usually required in a case of management of sickle cell anemia. It is only to maintain the hemoglobin. As of now, the answer should be a case of normal saline and oxygenation. ठीक है. तो याद रखना, अगर क्वेश्चन है सिकल सेल एनीमिया का and you're asked what is the next step to do or something, your answer should be always normal saline and oxygenation. Do not forget this answer. Okay, chalo. A 10-year-old child presents with lower abdomen pain, rashes over the lower limbs, pain in the joints. क्या क्या हो गया इसको? पेन एब्डोमेन है, rashes है, and arthritic pain है. क्या होगा इसको? Yes, it's a case of Henoch Shoreen purpura. Along with that is also palpable purpura. ये rash कौन सा है? These are rash of palpable purpura. If I ask you what is the fourth finding, guys, the fourth finding is surely glomerulonephritis. Okay, it's glomerulonephritis. So these four finding would be Henoch Shoreen purpura. Correct? अच्छा. अब क्वेश्चन है कि सर Alport syndrome में क्या दिखता है? Alport is a triad of, बताओ, A, it's sensory neural hearing loss. B, it is anterior lenticonus. And C, it is, yes, it's a case of hematuria and proteinuria. This becomes a case of Alport syndrome. सर टाकायासु आर्थराइटिस और टेम्पोरल आर्थराइटिस में क्या होगा? एज इज डिफाइनिंग फैक्टर. लेस देन 50 years of age here and above 50 years of age here, more or less they will have same finding, but just remember pulse less disease is Takayasu, and the pain in the jaw claudication is a finding of temporal arteritis. Okay, macrocytic anemia will be seen in, batao, this is microhypo, all these will show you microhypo. So yes, the answer is chronic liver disease can show macrocytic anemias. Next question, 10th. All of you answer it. Fatafat. A patient suffering from iron deficiency anemia, what stain would you use to confirm iron store depletion? Hanji, answer is Prussian blue. Yes, Prussian blue. देखो, Alisan red and von Cossa करते हैं for calcium. Okay, and methylene blue. These are not exactly the stain used to stain anything, but do remember all the cells in the hematology, they act along with methylene blue. We often use eosin dye, and this now is called Romanowski stain. And so these are used to stain the blood cells, and you can say RBCs, white blood cells, all can be stained by the methylene blue stain. So if the question is just methylene blue, what is used to diagnose or detect? The simple answer is WBC. Simple answer. White blood cell is used to often look by methylene blue stain actually. Okay. So here answer is clearly Prussian blue, also referred as pearl stain. Pearl stain. Chalo. A female went for camping with her friends and she has a bee sting injury, and now there's edema, redness on the face and breathing difficulty. What is it? Yeah, it's a type 1 hypersensitivity reaction. And do you remember it's also referred to as anaphylaxis right now? This patient right now has anaphylaxis. The question can be, what are the findings of anaphylaxis? Do you remember? After in minutes, after the antigen exposure, the patient can have any two of the following four. 1, 2, 3, 4. क्या क्या होगा? Number 1, it can be finding of skin features. Skin में क्या क्या होगा? Rash. They can be pruritus. They can be urticaria. ठीक है? Second can be respiratory distress. Respiratory distress. तो skin होगा, and along with that there's respiratory distress. The third one they can also be seen is actually hypotension. Okay, there can be hypotension, and along with that it can be GIT manifestations, which can be a case of pain abdomen, it can be nausea, vomiting, cramps. Those also are going to be seen. So if the patient has any two of the following four, any two of these four finding, it can lead to what is called as anaphylaxis, which you all know is a type 1 hypersensitivity reaction. ठीक है, clear है सबको? चलो next question. A couple is trying to conceive for the past 2 years. After unsuccessful trials, they have respect to examination. And what you find out? Female is completely normal and male has gynecomastia, scant pubic hairs, atrophied testis. क्या हो गया इसको? बताओ. Bolo. What does the male have? Yes, it's a Klinefelter syndrome. Very good. It's a 47XXY, and because of the Y is a male X है, extra X है एक male में, and hence the patient will have low testosterone level with a scant amount of the scanty and pubic hairs. Along with that, the patient will have increased amount of estrogen testosterone ratio, which can lead to gynecomastia. Plus, the patient will have high LH, high FSH. They have a long stature, referred to as a eunuch like body proportions, and then the patient can have high risk of type 2 diabetes and can also have metabolic syndrome, is a finding of Klinefelter syndrome. Okay, tell me, among all these four findings, which of these four will show you a normal, absolutely normal intelligence? Yes, the answer is Turner syndrome. बिल्कुल सही. Normal intelligence. Okay. Second question. Which of them can show you a rocker bottom foot and overlapping fingers? एडवर्ड में स्ट्रीक ओवरीज का कुछ चक्कर नहीं है. डोंट गो देयर. एडवर्ड्स में, यस, एडवर्ड में क्या होता है? दो चीजें होती हैं. नंबर वन, एडवर्ड्स विल हैव rocker bottom foot and there is a overlapping fingers. Okay, rocker bottom foot and overlapping fingers is what you see in an Edwards syndrome. Clear है? Next चलो. Glioblastoma, in which WHO, the moment this type of question comes, look at the suffix. क्या लिखा है? Blastoma लिखा है. What is blastoma? It's a highly malignant tumor. So even if you don't know anything about it, your answer has to be grade 4. अगर ये ट्यूमर होता with the suffix of oma, like oligodendroglioma होता, ependymoma होता, pilocytic astrocytoma होता, oma, can't be grade 4, has to be grade 1, grade 2, grade 3. But grade 4 will be only with blastoma. So can you give me one more grade 4 apart from glioblastoma multiforme, also referred to as medulloblastoma, is also a grade 4 WHO tumor. 14th, female patient with history of liver disease and hepatocyte with ground glass appearance. क्या हो गया इसको? Yes, it's a Hep B. It's a chronic Hep B infection. Chronic Hep B infection. Simple question है. No further discussion is required here. चलो. 15. A middle-aged presents with hypercalcemia and features consistent with renal insufficiency. On CBC, RBC count was severely decreased. Multiple article seen. Simple question. बताओ क्या आंसर इसका? Hypercalcemia, renal insufficiency, and there's multiple artery lesions. Answer बन गया? Yes, multiple myeloma. Very good. Answer is multiple myeloma. अच्छा, hyperthyroidism will not have these findings. Hyperparathyroidism can have this finding, but surely not hyperthyroidism. Do remember, if hyperparathyroidism has a lytic lesions, alkaline phosphatase level will raise there. In multiple myeloma, alk phos level is always normal because absolutely no bone formation is only bone lysis. There's no bone formation in the case of multiple myeloma. ठीक है, चलो ये आंसर बताओ. Tell me the answer to this question, all of you. I will not read it for you. पढ़ो. पेशेंट को लेथार्जी है, पैलर है, इरिटेशन है. ठीक है, नोन केस ऑफ आईडीए है, was being given oral supplementation, but now the clinician wants to give IV supplementation. What should be done? No, the answer is not ferritin. The answer is not ferritin. No. तो सर आंसर क्या है? देखो, how do we give the iron therapy? समझो, total dose is calculated from the amount of iron needed to restore the hemoglobin deficits, and along with that we also give an additional amount to replenish stores. But how to calculate the deficit of hemoglobin? How to do this? The answer is iron deficit is equal to body weight multiplied by target hemoglobin minus actual hemoglobin into 2.4 plus iron for stores, which is usually 1000 milligram, which usually is 1000 milligram. And therefore in this case, what you should do is first go and estimate the hemoglobin value. Why? Please समझो. For giving the IV iron supplementation, the way to give this is by this formula. By this formula, example समझो. Let's say कि एक patient का hemoglobin is 10. ठीक है? Okay, patient hemoglobin is 10. And now I want to give the patient intravenous iron therapy. How to give it? Body weight मान लेते हैं कि मेरे body weight का है and my body weight is 65 kgs. अब थोड़ा सा easy कर लेते हैं, इतना difficult नहीं करते, 60 kg. ठीक है? 60 kg into what is the hemoglobin? 15 minus 10 into 2.4 plus 1000 हम बाद में ऐड करेंगे. तो how to calculate? 60 into 5 into 2.4 plus 1000. अब कैसे करेंगे? पहले यू हैव टू मल्टीप्लाई दिस वन एंड हाउ मच इट इज. तो ये हो जाएगा ऑलमोस्ट इसको 2.5 मान लेते हैं, अराउंड इट इज 10 एंड इट इज अराउंड 15 एंड 15 into 16 कर देते हैं. तो 15 into 6 हो जाएगा, इट इज अराउंड 300. ओके, 300 एंड इट इज सॉरी 300 हो गया. सो नाउ वी हैव टू ऐड द 300 plus 1000. So it's 1300 is what you must give. The milligram of iron should be given. That's the deficit of iron. समझ आ रहा है? अरे आंसर बाकी लोग को छोड़ो भाई, जब मैं खड़ा हूं तो मेरा आंसर सुनो. The answer has to be the hemoglobin because this is how you calculate the iron deficits. The answer is not ferritin. Have I calculated wrong? मतलब I just don't want to make it wrong, तो मैं ठीक कर देता हूँ. I just don't want to make it wrong. देखो कैसे किया तुम लोगों ने. I just calculate this. So it is 60 into 5 into 2.4 which is 720. हाँ, तो yes, answer is 720 plus 1000. So it is 1720. Thank you for correction. ठीक है, that's the answer. It's not 1300. It's not 130, sorry. It's 1720. 1720, sorry. 1720. ठीक है? That's the correct answer. Sorry for this calculation mistake. I just was talking to you, so I didn't look at the actual calculation, but that's how you calculate it. ठीक है? हाँ, अगर क्वेश्चन में सेंसिटिव है, स्पेसिफिक है, इन दैट केस इट इज फेरिटिन. बट वो तो क्वेश्चन पूछा नहीं है ना. क्वेश्चन क्या, देखो, व्हाट इज द क्वेश्चन आस्किंग यू? द क्वेश्चन इज आस्किंग यू दैट फॉर गिविंग IV supplementation, what test to do? Look for the hemoglobin values. You don't have to do the values का important नहीं है, but देखो क्या होता है ना, the PYQ is very important. So since this has been asked, I would suggest you this better you just look at the answer and look at this formula. In case it gets repeated, you will have an advantage over others. तो if possible याद कर लो यार. Not for FMG. कैसे FMG के लिए नहीं है भाई? ये क्वेश्चन FMG का उठा रहा हूं मैं. तुम अपने से ले रहे हो कि तुम्हारे लायक नहीं है, तुम टफ लग रहा है तुम्हें. ये क्वेश्चन FMG का भाई, PYQ क्वेश्चन है ये. Not for FMG. This question is for FMG. This question is FMG PYQ. समझे? ऐसे नहीं बोलते हैं, FMG के लिए नहीं है. चलो. Pattern of inheritance seen with a disease inherited from grandmother to father and then from father to son. बताओ क्या है ये? Yes, father son चला गया. ये देखो यहां पर. Cannot be X-linked. ठीक है? But because there is no generation skipping and so has to be dominant. Answer is 80. Answer is 80. ठीक है? चलो. न्यूरोटिव डिफेक्ट्स कैसे होते हैं? Multifactorial. Q because can happen due to some pattern of folic acid deficiency, can happen because of some other problems also, and hence multifactorial. Always remember that when a question is a pattern returns for neurotive defects, it has to be multifactorial. Same thing also for diabetes, mellitus, hypertension, obesity. These all are multifactorial disorders. Okay, hypertension ले लो, diabetes है, obesity है. These all are multifactorial disorders. Okay, चलो. A 45-year-old patient presents splenomegaly and a CBC finding shows following. TLC is 1.2, is myeloblast है, promyelocytes है, metamyelocytes है 45%. क्या हो गया? Answer has to be CML. Why? It's surely showing a myeloid bulge with a basophilia and a myeloid bulge with neutrophilia. It has to be a case of chronic myeloid leukemias. Okay? अच्छा. In the same question, if this would have been myeloblast just only more than 20%, just this one. If समझो If the question would have been if the myeloblast would have been given more than 20%, then the answer would have been AML. समझ आ रहा है ना? In this case, it's myeloblast, promyelocyte, and prometamyelocyte all combined more than 20%. Hence, it's not AML. It has to be CML only. ठीक है? चलो, next question. A middle-aged man of your examination shows Benz-Jones proteins. So what will increase? Yes, it should be gamma globulins, correctly. Gamma globulin is what? M spike. And just to recall and remember, it is IgG, A, M, D, and E. तो मोस्ट कॉमन क्या है सर? IgG है. That's the most common one. जो कंफ्यूजन है पूछ लो. चलो. Dystrophic calcification is seen in, बताओ. Dystrophic calcification मतलब D for dystrophic, D for dead, and D for degenerated. Degenerated. D for dead and D for degenerated मतलब it has to be a necrosed tissue. Necrosis होना चाहिए. And so the answer is, अच्छा, and what was serum calcium? It should be normal. Now what you see is hypercalcemia में high calcium level रहेगा. Okay, increased calcium होगा. Vitamin D में high calcium level. This also has high calcium level. So all of these three are metastatic calcifications. The answer is B, which is a atherosclerosis, because this will show you a dystrophic calcification. ठीक है, क्लियर है? चलो. NF1 cafe allow spot of entrance कहाँ मिलता है? Yes, it is autosomal dominant. And what are the other findings? It is no space. What is no space? Neurofibromatosis, optic nerve glioma, ठीक है, sphenoid dysplasia, plexiform swelling मतलब bag like swelling, bag, axillary freckles, okay, cafe allow spots, and in the eye there is Lish nodules on the iris, and it's with NF1 on chromosome number 17 long arm. ठीक है, चलो next question. Most common lung cancer in India and worldwide. Remember, now the answer is adenocarcinoma. The most common lung cancer in India was squamous cell cancer 3, 4, 5 years back, but recent edition of books tell the most common lung cancer in India and worldwide is adenocarcinoma. याद रहेगा सबको? चलो. And in this way, we have finished the next part of the 2022 question. Also, we now move to January 23 questions as well. All of you ready? Give me a thumbs up. All of you, give me a thumbs up. तभी आगे होगा क्लास अब. You should not leave this session. अभी session को सबको भेजो. Call all of your friends to join it, and from this we'll move to 2023 onwards. ठीक है? Just share the video to your friends and ask them to join also. For those who had dinner, let's move ahead. चलो. A patient presents with hematuria and hemoptysis. Investigations also revealed anti-GBM antibody. क्या हो गया क्या इसको? अरे वाह, ग्रेट. चलो तुम लोग के लिए एक लाइक ठोकते हैं इसमें. ऐसे बोलते हो ना तुम लोग, लाइक ठोक दो. ठोका दिया. आंसर बताओ. आंसर गाइस, anti-GBM antibody क्या होगा? Very good, good. Pasher syndrome. Yes, good. Pasher syndrome. देखो, IG is also called as Berger disease. It produces gross hematuria and 1 to 2 days of sore throat is what you see in IG nephropathy. अगर क्वेश्चन होता about vaginous, will show you lung cavitations in the lungs, and along with that will show you C अंका. चलो next one. TAM hauser protein are seen in, किसमें दिखता है? Yes, it's seen in Hallen cuts. Okay. 18-year-old boy presents with OPD and has recurrent jaundice. Lab study reveals ALT, AST, serum bilirubin 5.1. Now the patient has direct bilirubin of 0.6. Okay. and has total bilirubin of 5.1. मतलब it is indirect bilirubinemia. ठीक है. The patient recurrent jaundice since childhood. Best answer is Gilbert syndrome. Why so? Because the patient may have a finding of Dubin-Johnson will have increase in direct bilirubin. ठीक है. In hemolytic jaundice, the patient will have some history of gallstone formation. They're finding also, and this is often autosomal dominant disorders and present since childhood. ठीक है. If something is on and off since childhood, increasing, decreasing, varying हो रहा है, it always is Gilbert syndrome. How to know is indirect? Because यहाँ क्या लिखा है? 5.1 है and direct is only 0.6 and so is indirect bilirubin. ठीक है, अब क्लियर हुआ? So with is this disorder? It's a multiple myeloma surely. Simple question छोड़ दो इसको. The following is involved in extrinsic pathway. बताओ. Kriller is very severe. That's one of the better answer. Kriller is very severe, especially Nagar type 1 is very severe and 2 is less severe. Gilbert is not so severe. Yeah. So answer. Extrinsic pathway में क्या होगा? It is 7. Yes. Very good. Next one. Finding of hemolysis. Do you see reticulocytopenia? No. Neutropenia? No. Decrease hapto? Yes. In which one? Intravascular hemolysis will show you the low amount of haptoglobin. Spectromy will be useful in the following. Batao. In what cases do you advantage of spectromy? Yes, it's both ITP and HS. So the answer is both A and B. अब देखो तुम फिर बोलो क्वेश्चन नहीं पढ़ा हमने. You all are answering HS. ITP will also be relieved by spectromy. Yes, if the option would not have been C, then the answer would have been B. ठीक है. However, because you have a ITP also, ITP का best treatment क्या होता है? Tell me where are platelets destroyed? Spleen में. If you remove spleen, surely the patient will be benefited. Better answer is A and B. हाँ, अगर आपको चूज होना, if C is not in the option, then the B would have better answer than A. Agreed. But यहाँ पर C है ना, मैं बता रहा हूँ, प्लीज क्वेश्चन ठीक से पढ़ो. वो पेन ना तुमको बर्दाश्त नहीं होगा. ठीक से क्वेश्चन पढ़ो. ओके. In sickle cell anemia, बताओ, glutamic acid to valine on the 6th position detergent. ये तो सिंपल क्वेश्चन है, इसको छोड़ो, डिस्कस नहीं करना है इसको. 11th, 50-year-old patient with OPD and headache. Findings reveals tumor of 2 into 2 centimeter attached to matter. क्या है ये? Typical disease. 2 into 2 centimeter attached to matter. What is a contraindication for splenectomy? Number 1, if there is any spleen trauma, okay, or if there is a typical spleen rupture, then we don't remove spleen. Elsewise, we can remove spleen. Okay. Yes, it is meningioma. Very good. This is meningioma, and for meningioma, your answer has to be very good. Samoma body. Okay. अच्छा, एंटनी ए एंटनी बेरो के बॉडी कहाँ मिलता है? It's seen in schwannoma. ठीक है. And egg yolk in oligodendroglioblastoma is surely seen, but here the answer is some bodies as in meningioma. Very good. Duratail sign. Very good. Duratail sign. Perfectly answered. चलो. A 44-year-old suffers from wheezing, coughing every year at the same period of time. Declination of which the following is responsible for these type of findings. बताओ. Yes, declination by mast cell is the basic reason, because this is what releases histamine. Do you remember? If the question is mast cells have, the answer is they have Fc receptor of IgE. But declination of mast cell and also can be inhibited. To inhibit this, or you can say stabilize the mast cells, we also use mast cell stabilizers like sodium chromoglycate. ठीक है. Here the answer is A. A child underwent ocular surgery for tumor wherein enucleation is done. For which tumor do you do this? Okay, we do this for, yes, trypanoblastoma. So RB gene involvement is seen. Simple. श्वानोमा में क्या मिलता है? We get एंटनी A, एंटनी B and Verroque bodies. ये वाला. This is what you see in schwannoma. ठीक है? Next question. What is this pattern of inheritance? बताओ. What is this, guys? आंसर फटाफट. देखो, when you see a male transmitting to son, ठीक है, male transmitting to son, this doesn't look to be a case of X-linked, right? There's no generation skipping. So what is it? It surely is a case of dominant inheritance. D. अब it can be AD or can be XD. क्या होगा बताओ? Why are you saying AR? देखो, if you look at the AR, child diseased है, both parents are normal. Correct? Child diseased है and both parents are normal here. So what do you think it is? समझा रहा हूं बच्चे, पहले आंसर तो बताओ मुझे. सी द होल पेडिग्री देखते हैं. देखो, चाइल्ड डिजीज्ड, वन पेरेंट डिजीज्ड. ठीक है, चाइल्ड डिजीज्ड एंड वन पेरेंट डिजीज्ड. करेक्ट. यहां पर चाइल्ड डिजीज्ड, बोथ पेरेंट डिजीज्ड and these children are diseased and the both parents are diseased. One mother parent diseased. This looks to be a case of dominant condition. But what you're finding here is child diseased है and both parents are normal. This is a bit unique case. ऐसा होता नहीं है. Okay, so let's see how to solve a pedigree question. देखते हैं. देखो, 3 rules we should apply. The rule 1 says, it says, first look for mitochondrial. In mitochondrial, mother will transmit to all children. Mother to all children. ठीक है. Second is rule of dominance. देखो, to say for dominant condition, if a child is diseased, one of the parent must be diseased. One of the parent must be diseased. ठीक है. And third condition is X-linked rule. X-linked rule says that if a father is transmitting to son, it cannot be X-linked. It cannot be X-linked. So what you are saying here is, I completely agree that if you go from down to up here, that this parent is diseased, again this parent is diseased, but the same rule is not being followed here. And so we cannot say it's sure short a case of dominant condition. It can be recessive. Now it can be X-linked dominant or can be a case of, देखो, this cannot be mitochondrial. Why not mitochondrial? Because mother, so father is transmitting. So it can't be mitochondrial. Now look at the second rule. It says if a child is diseased, one of the parent must be diseased. Is it being followed? No, and hence it cannot be dominant. Now it can be X-linked or can be autosomal. What you say is, you see, a male is transmitted not to son. ठीक है. Look at the male transmitted to son. But what is happening here is, this male, let's say इस male को disease है. Let's say the male has a condition of, एक example मान लेते हैं, that suppose it is a case of XC Y and this X and X. Example लेते हैं, just to make it understand. So what happens in this case is, X और X यहाँ पर है it should be X, XC, XY, XCX, and XY. So what should happen is, as you see here, the female should become a what? Should become a carrier. Okay. But what is happening is the female is getting diseased. That means what might have happened is here the female should have been a carrier also. Only in that case what will happen, it'll be XCXC and XCXC. What the point? So this would be possible. See, if I'm saying disease कौन है? Male है, right? And now I'm saying the female has got diseased. But the point is, this would have been possible only if this lady is a carrier. Only then the male would become normal and the daughters would become diseased. And so in this case, it has to be a case of a X-linked recessive. It has to be a case of X-linked recessive. Only then this whole thing is possible. Else it cannot be. Else it cannot be possible. ठीक है? So I have some more particular question also. Let's solve that too also. But right now let's move ahead. ठीक है? So comment on the finding given in the image below. बताओ ये क्या है? Yes, it's a case of Capri hemangioma. Okay, it's a case of Capri hemangioma. Acha. No, it can be air, but I cannot explain you why. I cannot explain you because why it can't, it doesn't look like to be air also, because in this case I'll come back to this question later on, है ना? अभी बहुत टाइम निकल जाएगा. I'll just move forward. I'll just again come back to this question later on. अभी आगे बढ़ते हैं, ठीक है? A 50-year-old patient presents with knee joint pain to the OPD. Then there's needle-shaped crystals were found, but were negative bifringent. क्या होगा ये? Negative bifringent. What is it? बोलो answer 16. Yes, gout. Why? Because pseudogout is positive bifringent. Okay, this is positive bifringent. Do you remember this? A 36-year-old male suffering from finger enlargement in the foot, acromegaly. What should be the treatment for this patient? वैसे ये फार्मा क्वेश्चन है, तो इसको हम आगे बढ़ते हैं अभी इसमें, ठीक है? ये देखते हैं. A 53-year-old male present with backache and light tick hip lesions. The patient has a fatigue and pallor. Calcium level is for 12.8 and plasma cells for 42%. What is it? It's a case of multiple myeloma. It's a case of multiple myeloma. ठीक है? Damage to these cells. Which cell? This one. बताओ, what is this? What do you think are these cells? ये वाला. Look at this whole thing in the magnification. These all are basically acinine glands. हैं ये सब. These all are glands. Okay, these are all glands. Round glands are being seen. And in between the glands, you see a bigger large structure which has cells here. This is basically islet cells of Langerhans. Islet cells. So because it's islet cell, what it can be? If you damage is damage, it can lead to diabetes mellitus. Yes. Okay, it can lead to diabetes mellitus. Antibody present in highest concentration blood. Which is the maximum antibody? Tell me. Which of this antibody is maximum? बोलो बोलो. IG maximum percentage. क्या हो गया तुम लोगों को? क्या हो गया? तुम सो रहे हो क्या? Tell me the answer fast. Antibody concentration. Yes, तो GAMDE तो इसमें है ना, in multiple myeloma it is there. But what about the antibody concentration? गैमडे तो मल्टीपल माइलोमा में है ना. आई एम आस्किंग यू व्हाट इज अ बिग विच ऑफ देम इज अ मैक्सिमम एंटीबॉडी कॉन्सेंट्रेशन. बताओ. You might have read all of them in the microbiology. IG, G या M, which is maximum in percentage. The question is, which of them is highest concentration in the blood? क्यों गड़बड़ कर रहे हो? देखो, all of it कोई कह रहा है G कह रहा है, कोई M कह रहा है. Look at this whole thing. देखो, if you look at the antibody, actually in the blood, एक ना टेबल होता है. You might have also seen these tables. देखो, antibody का ना टेबल आता है. I'll just share that table also with you. फंक्शन के साथ, हाँ, ये वाला. ठीक है. So if you look at the whole thing, and if you look at the 5 type of antibodies, you have to look at few important things they should know here. One of them is which is heavy chain, number of antigen binding chain, molecular weight कितना होता है. So there is a percentage of this antibody in the serum. देख रहे हो? तो maximum in the body is 80%, which is IgG. Okay? तो IgM नहीं हो सकता ना. IgG is the maximum percentage. So this is a very very important table. इसको ठीक से पढ़ना. The maximum complement fixation is also with the IgM, which is a bigger antibody. And do remember that IgG is the maximum percentage, not the IgM. And as you very correct told me, GAM day is a very simple way to remember it. And so the answer should be IgG here. ठीक है? अब नहीं भूलोगे? IgM is the biggest molecule. Maximum concentration is IgG there. Okay? चलो 22. फैक्ट्री वर्कर का गैस्ट्रिक अपसेट है. एंड फ्रेंड ऑल्सो एट द सेम थिंग. क्या हुआ होगा? हेप ए. ओके. हेप ई भी हो सकता है, हेप ए. बोथ ऑफ देम आर फीको ओरल एक्चुअली. तो आंसर इज हेप ए. अच्छा, मोस्ट कॉमन कॉज डेथ इन डीके इज बेसिकली डिहाइड्रेशन. छोड़ देते हैं, इसको देखते हैं. इसको मेडिसिन क्वेश्चन छोड़ देते हैं. लेट्स मूव टू दिस वन. इल प्रेजेंस विद हेडेक, पैल्पिटेशन एंड स्वेटिंग, and there is adrenal mass is also noted. क्या होगा इसका बताओ? इट इज फियोक्रोमोसाइटोमा. हेडेक है, पैल्पिटेशन है, स्वेटिंग है, एंड देयर इज अ बिग लार्ज एड्रेनल मास. इट हैज टू बी फियोक्रोमोसाइटोमा. ठीक है. ए. अच्छा, आर ए अकर्स टू ईच ऑफ द फॉलोइंग. दिस अ बिग कंफ्यूजिंग क्वेश्चन. देखो, इट कैनॉट बी 1 and 2, ये पक्का है. It can be autoimmune, it can be inflammatory, it can be type 4 also. But I have to choose only one option. The best suitable answer here is autoimmune disease. That's the best answer. It can be B, C, D all, but if you have to choose one single answer, the best answer is autoimmune disorders. Adult male suffers from RTA. Grafting was done using his own tissue. Which specify the type of graft here? ओन टिश्यू है. क्या होना चाहिए? यस, इट शुड बी ऑटोग्राफ्ट. करेक्टली, इट शुड बी ऑटोग्राफ्ट. ठीक है. चलो 30. अ 7-year-old चाइल्ड प्रेजेंट विद हाइपोएल्बुमिnemia, एडिमा है, हाइपरलिपिडीमिया है, एंड प्रोटीनुरिया है. देन द पेशेंट is given steroid therapy and the kidney biopsy shows normal finding, but EM shows effacement of food process. What is the finding? Yes, the answer is minimal change disease. Remember, RP में क्या मिलेगा? क्रेसेंट्स. ठीक है. इन एम्पीजन टाइप 1 है और टाइप 2 है. टाइप 1 shows tram track appearance and type 2 shows what? Dense deposit disease. In FSCs we see focal segmental fibrosis. Okay. ठीक है. Here the answer is minimal change disease. Okay. चलो. A 24-year-old patient present with hematuria and edema, history of sore throat 10 days back. Lab investigation showed hypocomplementemia. History giving you a sore throat history 10 days back, and lab investigation showed hypocomplimentemia. क्या होगा ये? It can be PSGN. Okay, it has to be PSGN. A 6-year-old patient with Cushing syndrome, what is the most common cause? Most common cause of Cushing syndrome क्या होता है? Most common cause of Cushing syndrome. It is ectopic ACTH. Very good. The most common cause is always ectopic ACTH as a rule. Okay. वैसे स्टेरॉइड होता है, मतलब बेस्ट मोस्ट कॉमन कॉज होता है द एक्टोपिक स्टेरॉइड इनटेक, बट वो ऑप्शन में नहीं है, एंड हेंस हियर द आंसर इज एक्टोपिक एसिड सिक्रेशंस. वैसे मोस्ट कॉमन कॉज इज एक्टोपिक स्टेरॉइड इनटेक, जो कि यहां पर ऑप्शन में नहीं है, एंड हेंस द बेटर आंसर इज ए. चलो, a 3-year-old chronic smoker presents to OPD with changes seen in the image given below. क्या हो गया इसको? स्मोकर है and you can see gangrene here. What might have been the possible answer or reason? It can be Berger disease. Okay, it has to be Berger disease. अच्छा, बर्जर यहाँ पर BER स्पेलिंग ही गलत है, BER BUER है ना, BUER, this one, not this one, because this is IgA nephropathy. Okay, in Raynaud's क्या होगा? It's a pain on cold exposure. Where it is a pain? Okay, it's pain on the extremities on the cold exposure. ठीक है. Nitrous oxide is a potent vasodilator of the following. I know, बताओ. Yes, arginine to citrulline, and this is what makes nitric oxide in the presence of nitric oxide synthase. The answer is A. Burger nahi re, burger. Owl eye inclusion bodies, tell me. Owl eye inclusion bodies. It is, yes, Epstein-Barr virus. Very good, Epstein-Barr virus. नहीं, साइटोमेगालोवायरस. अच्छा, ऐसा क्यों? देखो, EVB में we often get a mononuclear cells, but this is a typical case of a cell with a nuclear inclusions ऐसा, and around there is a halo. This typical halo, ये halo है ना, is what is seen in the cytomegalovirus infections. ठीक है. A 48-year-old factory worker comes with complaint of respiratory distress to the clinicians and had asbestosis. So which tumor he can have? The answer is yes, malignant mesotheliomas. That's the most common tumor. I'll not say the most common tumor, sorry, specific tumors. Okay, the most common tumor in this case obviously is adenocarcinoma of lung, much more common than mesothelioma. But since the question actually is asking you the specific tumor, answer has to be malignant mesothelioma. Okay, but agar question the most common tumor, it would have been adenocarcinoma lungs. ठीक है. A 6-year-old patient has MI, and on the biopsy, red and white patches are observed. What stain is to confirm this? Answer is triphenyl tetrazolium chloride. This typical stain, if you have the LDH in the heart present, positive होगा, will give which color? Will give you red color. ठीक है. If negative होगा, will give you pale color. Now the question is, which is red color? It's a viable area, and this area is a infarct area. Okay, the answer is TPTC. This is used to stain what? Reticulocytes. Suprachoroidal staining. Oil red for lipids, and Congo red is often used for staining amyloidosis. Okay, TPTC, triphenyl tetrazolium tries. हाँ, LDH1 एंड LDH2 का शिफ्टिंग भी होता है. दैट्स ऑल्सो वेरी इंपॉर्टेंट पॉइंट पुट फॉरवर्ड बाई शाहिद. दैट्स वेरी ट्रू. ओके, चलो ये बताओ. कंप्लेंट्स ऑफ सीवियर हेडेक एंड विजन लॉस, क्या हो गया इसको? मोस्ट प्रोबेबल कॉज क्या होगा? इट इज टेम्पोरल आर्थराइटिस, ऑल्सो कॉल्ड एज जायंट सेल आर्टेराइटिस. ठीक है, रिमेंबर इसमें द मोस्ट कॉमन सिम्टम इज हेडेक. The most common vessel involved is superficial temporal artery, and this typical finding is referred to as a AION, anterior ischemic optic neuropathy. This shows what is called as pulseless disease, also referred to as Takayasu arthritis. The main vessel involved is subclavian vessels involved. Is the most common vessel involved in Takayasu arthritis. ठीक है. Macrophage are inflammatory lesions, cells which are responsible for killing pathogens in chronic inflammations. In liver, what will be the cell responsible for these functions? बताओ. It is Kupffer cells. Very good. Kupffer cells. What does ito cells do? It's also referred to as red cells, and they have two functions, dual functions to say. One is to store vitamin A when they're inactive, and they also are a modified fibroblasts, and hence they can also take part in repair. These cells are also modified macrophages, but these are where? In the kidney. Okay, and these are the other cells. Astrocytes also are macrophages, but they are present often in different type of organs. Okay. This is a typical binucleate owl eye appearing cell, but doesn't have a halo. देखो, now compare this image to the image I showed you here. ये देखो. So what you saw here was a typical halo. The halo was seen in cytomegalovirus. ठीक है. But now halo कहाँ है? ये देखो, halo दिख रहा है ना, ये वाला, this halo. But if you see supposedly one acid, this type of cell, this becomes a Reed Sternberg cells, RS cell. Okay. So understand the difference between, if you get a halo, it's cytomegalovirus, but if you get a cell like this one, that becomes a typical case of Reed Sternberg cells. Okay. Mott cell is seen in multiple myeloma. Popcorn cell is seen in LNH variety of NLPHL. Okay, predominant Hodgkin lymphoma, and it's not shown, not a lymphoblast here. ठीक है. चलो, now we move to the last one of the recent FMG question, and that is for the June FMG 24 wala. Okay, June FMG 24 session. Let's move to that one. Okay. कहाँ गया? हाँ, ये देखो. चलो, we now move to the July 2024 session वाला. First one, primary lymphoid organs. बताओ क्या वाक्य है इसका? Primary lymphoid organs. हाँ, PDF में भेज दूंगा बेटा. Jan'25 बोल दिया क्या मैंने? नहीं, Jan'25 का तो आएगा भी. I didn't say Jan'25. Might have been just a slip of tongue. But क्या होगा इसका आंसर? Yes, thymus. Remember that usually if you talk about the lymphoid organs, there's only two of them. One is a bone marrow and one is a thymus. Everything else is secondary lymphoid organ. Here the better answer is thymus gland. ठीक है? Okay, this one. So there was a lot of confusion in the pedigree. Let's solve this one. I told you 3 rules for solving pedigree. The first rule is mitochondrial. So is it mitochondrial? Mother to all children. Mother to all children becomes surely a case of mitochondrial pattern of inheritance. ठीक है, 3 rules I told you, always apply that rule only. You'll solve all properties based on 3 rules only. This one again, देखो same question आ गया, ये क्या halo है. The moment you get halo, it becomes a case of cytomegalovirus. ये बताओ, 50-year-old patient has cervical lymph node enlargement. Biopsy reveals granuloma and necrotizing inflammation. The following can be seen with this. बताओ क्या होगा इसका आंसर? There is a necrotizing inflammation, so cannot be metastatic. Dystrophic होगा. Now, does dystrophic has high calcium level? No. So the answer is D. Dystrophic with normal serum calcium. ठीक है? The following is decreased in acute inflammation. Answer is albumin. Okay, these all are positive APR. Albumin is a negative APR. What is the tumor marker for Castleman syndrome? 5-HIA, which is a marker for serotonin. Okay, this is for Melry thyroid carcinomas. This is for pheochromocytoma. But do remember, if the question is what is the best marker for pheochromocytoma, the best answer is metanephrine. If not in the option, go with VMA. If not in the option, go with norepinephrine/epinephrine. So here the answer is 5-HIAA. What group should be given to Bombay blood drop? Tell me this answer, all of you. This is very, very important question. Can we repeat it this time also? Tell me the answer. Yes, very good. The answer is O, small h. Okay, or the option can also be small h. ठीक है. Among these, who is the universal donor? Universal donor. Okay, for a packed RBC is O negative, a better answer than O positive. However, if the same is thing for FFP, then that is AB negative as a better answer than AB positive. Now remember, this bomb blood group, the problem is they lack the H antigen. Because they lack at H antigen, the Bombay blood group, so we call them O small h or smallest small h. And so what do they have is they have anti-A, anti-B, and they also have anti-H. And so the only blood group they can accept is their own blood group. Okay? Did you get the point? O small h क्या है? देखो, capital H, please समझो, capital H is the one which makes A, B, and AB and O. So if a person does not have capital H, okay, if they lack capital H, we can call them O small h or small h. ठीक है? In this case, this is called as Bombay blood group. This is called as Bombay blood group. Did you get the point? सब यहाँ सब लोग हुई है? चलो, disorder associated with hexanucleotide repeats, बताओ. अच्छा, I want not only the answer here, I want you to tell me which repeat is seen here. Which repeat is seen here? Tell me. The answer is yes, it's basically amyotrophic lateral sclerosis, that is ALS, and which is also referred to as frontotemporal temporal dementia. Frontotemporal dementia, right? So in this case, what happens? It is a typical mutation of C9ORF72. Now, this typical gene mutation, they often lead to repeat of GGGGCC. Because of the 6 nuclear repeats, it is referred to as hexa nuclear repeats. Okay, we call them G4C2. G4C2 is how you will call the name. G4C2. Okay, क्या बोल रहे हो? फ्रेडरिक्स अटैक्सिया. हाँ, ये फ्रेडरिक्स सिंड्रोम के लिए होगा. हाउ टू रिमेंबर दिस होल स्टोरी? देखो, द रिपीट कैन बी आदर हंटिंगटन्स, okay, or it can be, this is for CAG, it can be fragile X syndrome, which is CGG. It can be Friedreich's ataxia, it is GAA, and can be myotonia dystrophica, which is CTG. Now, how to remember the whole story? I hope you remember this one is Hunter. This we all know this Hunter. उसका केज होता है, right? Now for ataxia, which is a gait problem, for ataxia, okay, this is a gait problem. Because of gait problem, GA है ना, तो यहाँ पर GAA repeats होगा. And for myotonia का T है, this also has T repeats, CTG repeats. Okay, so यहाँ पर G है, this also G repeats. So the only new question that came up this year was this one, which is frontotemporal dementia, and the answer is it has a repeat of G G G G C C. The 4G and 2C. 4G and 2C. ठीक है, याद रहेगा ना? This 4G and 2C for frontotemporal dementia. चलो, next question. अच्छा, most common anemia is surely iron deficiency anemia. चाहे कोई भी एज हो, until and unless there is no malignancy return or autoimmune disease mentioned there, do not mark ACD. They are seen only in malignancies. They are seen in autoimmune disorders and can be seen in chronic infections. So here the answer is B actually. A 38-year-old patient with abdominal pain, joint pain, and palpable purpura. We have solved this question, right? It's a case of IgA vasculitis, Henoch Schönlein purpura. ठीक है? Multiple niche nodules is a feature of. Yes, answer is A. And which one? NF1 or NF2? It is NF1. ठीक है? A 46-year-old male has presented OPD with lower backache and painful urination. Hypercalcemia है, M protein है, and what is it? It's surely a case of multiple myeloma. So what test to do? It should be Benz-Jones protein in urine, and which are light chains. Okay. So what is Benz-Jones protein? You take a urine sample in test tube. Okay. So when you heat it at 55 degrees Celsius, you see a precipitate. When you further heat to 95 degrees Celsius, the precipitate would disappear. Negative हो जाएगा. ठीक है? Again you cool it, would appear. You heat it, disappear. This typical finding is referred to as Benz-Jones protein. ठीक है? Trisomy. What to see here? ध्यान से देखो. What to see here? Yes, it is extra 18, and his extra 18 is called as Edward syndrome. Correct. Okay. 13 is Patau syndrome. 21 is Down syndrome. This is nothing. Just छोड़ दो. The answer is A. 14. Most effective is, I told you, this is a very confusing question that came last year. तो देखो, most important, most effective, इसका आंसर क्या बताया था मैंने? For those who are listening from the beginning, tell me what is the answer I told you for this answer. What answer I told you there? So, yes, it is NADPH oxidase. ठीक है? MPO is the most efficient, but most important is NADPH oxidase. Okay? Catalyst क्या करता है? It converts H2O2 to H2O and O2. This is a function of catalyst. Okay. I think I just skipped one year. I think I just skipped the January last year. है ना? वो discuss कर लेते हैं. I think I skipped that part. There's some error there. This one. है ना? This one was skipped. Sorry. Let's discuss this one as the last session here. The first one. With Ritter syndrome, what is there? Very simple. परी होता है इसका निमोनिक. परी. किसका निमोनिक परी होता है? 27 का. It is psoriatic arthritis. Psoriatic arthritis. Okay. Ankylosing spondylitis. It can be Readers and can be IBD. सबसे सिंपल क्वेश्चन है. 27-year-old परी. एकदम इजी है. ठीक है. DR3 and DR4. How to remember this? D और R मतलब डायबिटीज और RA. ठीक है. एंड फॉर सीलियक इट इज HLA DQ2 DQ8 एंड B8. यह है सीलियक के लिए. पेयर बोल सकते हो, परी बोल सकते हो. मैंने इसको परी से याद किया, तुम पेयर बोल सकते हो. सेम थिंग, कोई फर्क नहीं पड़ता. ठीक है. नेक्स्ट देखो. अ चाइल्ड हैज टर्नर सिंड्रोम. द फॉलोइंग विल बी फीचर टर्नर सिंड्रोम. Webbed neck, yes, they always have webbed neck. They have increased carrying capacity. दो gynecomastia, and they have the low height, short stature होता है. They have short stature. So the answer is A. चलो. Smoker है, backache, fever है, and has similar episode, multiple episodes of the past, and has elevated lipase enzyme. क्या हो गया इसको? Pancreatitis, yes, acute pancreatitis. तो क्या हो गया होगा? Fat necrosis, type of liquefactive necrosis is the acute pancreatitis. Answer is B. But the best answer is B. If not in the option, would then have gone with D. Okay. Where do you get this one? You get this fibrotic necrosis in three conditions. We get this in malignant hypertension. We get this in vasculitis. And we get this also in the immune complex deposits. Question number 4. A 16-year-old girl with short stature and amenorrhea. What is it? Yes, it's Turner syndrome. And what is Turner? 45XO is Turner. ठीक है? What has happened here? बताओ, which tumor is this? Look at this typical squamous cell at the top. ये squamous cells है. And these are nests. Nests of tumor cells in skin. Yes, it's a case of basal cell carcinoma. Very, very good. देखो. And do you remember, if the same image is shown in higher magnification, this nesting will show you the tumors at the periphery arranged like this one. ऐसे. Do you know what is this called? This type of tumor cell arrangement at the periphery? Any idea what is this called? It's called as palisading. Okay. This typical finding of a nesting pattern. So sir, why is this not squamous cell carcinoma? Because this will show you a pink color keratin pulse. Okay. So if the same question would have been, the tumors will have shown you the pink area here. As this would have become a case of keratin pearl, and the whole thing would have become a squamous cell carcinoma. But in center, there is no pink area. Because there is no pink area or nest mil rahe. These all are nesting. You are all their nests. It becomes a case of basal cell carcinoma. Ab clear hai sabko? What is BCC? What is apoptotic body? It consists of cytoplasm, nucleus, as well as organelle. Okay. And what and who removes it? Yes, they're removed by macrophages. What is the process called? It is called as efferocytosis. ठीक है? हाँ, very good. It's called rodent ulcer. Very good. It's also called rodent ulcer. Rodent ulcer. Very, very good. Yes. Okay. ऑप्टिक नर्व ग्लायोमा, ये हम पढ़ा दिया, देखो इस NF1. अच्छा, NF2 कैसे याद करोगे? मिस मी, ऑल ऑफ यू मिस मी. कैसे? 22Q मतलब मल्टीपल इनहेरिटेड and 3 tumors, schwannoma, meningioma and ependymoma. Schwannoma, meningioma और ependymoma. ठीक है? That's a NF2 syndromes. Mutation to PH chromosome. क्या हुआ है? Yes, it should be reciprocal translocation. क्या हुआ है? Chromosome 9 है and 22nd है. What has happened? 9th है, 22nd है. तो on 22nd the 9th one has joined. ऐसे. ठीक है? That's a 922. We call them translocation. Reciprocal translocations. ठीक है? चलो. अच्छा, what is this? ये क्या है? देखो, this is a typical mobile rubbery mass in left breast. तो even if you don't know what the image is, mobile है और rubbery mass है. It has to be fibroadenoma. But what is this? देख लो, these all are stroma. Okay, stroma है, and these are the compressed glands. Compressed gland. So because you get a combination of stroma and gland, it becomes a case of fibroadenoma. Fibro मतलब fibrosis, collagen है, and there is adenoma मतलब gland है. If you get a combination of gland with a fibrous tissue, it becomes a case of fibroadenoma. ठीक है? 10th. Variety है, spleen palpable है, antral umbilicus along with petechiae and bleeding. WBC count is 85. Immature B cells in peripheral blood are seen. क्या है ये? Yes, it's a case of ALL. To be more precise, BALL. BALL. Okay. No, it is not phalloids. अच्छा, just to tell you, Sajid, what is phalloids, वो देख लेते हैं एक बार. देखो, phalloids में ना, you will not get the glands. Do you remember this? I am showing the image of phalloids tumor, but in phalloids will not get the glands. देखते हैं phalloids tumor का कोई histology देख लेते हैं. Will be more easy to understand. देखो, now compare these two images. I think I'll show you a more clear image. This is a very small one. हाँ, ये देखो. तो in phalloids you will only see stroma. बस stroma मिलेगा, glands are not seen. Okay, and because of no gland seen, is referred as phalloids tumor. I'll take a better image of histology. Phalloids का histo लिख देता हूँ मैं, and I'll show you better diagrams there. देखो, look at this one. So in this one, you see the whole area. कहाँ गया? Sorry. हाँ, look at this one. The whole area is just a stroma. There's no gland. If this would have been showing glands there, would have become fibroadenoma. This is called leaf-like pattern. Leaf, large leaves are therefore seen as a phalloids tumor. देखो, this is a phalloids tumor. Now, just to compare this thing, I shall also show you a image of fibroadenoma. वो देख लेते हैं. तो in fibroadenoma, do you remember आपको मिले glands. तो if you see glands, then it becomes a case of fibroadenoma. देखो. So ये देखो. You see so many glands here. If you see glands, it becomes a case of fibroadenoma. If you don't see glands, it becomes a case of cystosarcoma phalloids or simply cases phalloids tumor. याद हो क्या सबको? If you see glands, fibroadenoma. If you don't see glands, it becomes a case of phalloids tumor. क्लियर हो रहा है सबको? चलो, क्वेश्चन नंबर 11. Painless testis mass and the patient has Rinky restals. कहाँ दिखता है ये? Yes, Leydig also referred to as hylar cell tumor. Okay, hylar cell tumor. Yolk sac shows what? Schiller, dual bodies. Acha, least radiosensitive, which will have no nucleus, right? So answer, 12th answer, least radiosensitive. Everyone answer करो फटाफट. 12th answer, 12th answer. Yes, B, platelets. ठीक है. Patient presents with outpatient department with fatigueness and hemoglobin of 5.9. Increase RW and TIBC. क्या है ये? High TIBC surely becomes a case of iron deficiency anemia. Iron deficiency anemia. अच्छा. In this question, if this platelet नहीं होता, then the answer would have become RBCs. But platelet is the least radiosensitive. ठीक है. The following investigation of choice in CML. Answer is fish. The best choice. Lab is low in case of CL, but not so specific tumor, specific staining though. But we can do lab score is low in case of CML. Okay. Recurrent bacterial and fungal infection is seen in the skin and respiratory tract. Multiple abscess है and lymph node enlargement है. Dihydrorhodamine test is positive. And so what we do this? Yes, we do this for CGD. Very good. We do this for CGD. Okay. So देखो, tell me in which disease you see LAD1 and LAD2. LAD1 is a defect of beta 2 integrins. Beta 2 integrins, right? LAD2 is CLL Lewis deficiency. Okay. CGD is a defect of PHOX Fox gene. And what about the Chidia Higashi? Chidia Higashi is a defect of Fox gene. Sorry, Chidia Higashi. This is a defect of LYST list gene. Defect. Okay? The following is correct about nets except. So net can be seen in SLE, surely. It is never involving phagocytosis. It actually destroys the cells outside the cells and hence doesn't involve phagocytosis. Seen in sepsis and often arginine is needed to destroy the whole thing. Very good. Umbilical delayed closure, not umbilical delayed closure. Delayed separation of umbilical stem is seen in the LAD1 and LAD2 patients often have Bombay blood drop. Okay. LAD1 में होगा delayed separation of umbilical stem and LAD2 patient will have delayed have the Bombay blood drop. अच्छा, men 1. How to remember 3P? First P, parathyroid adenoma and hyperplasia, pituitary adenoma, and it can be pancreatic tumor. Okay? So in this, the best answer is the parathyroid adenoma. In fact, it's the most common is parathyroid only. In pituitary, we often see prolactinoma. Okay? In pancreas, insulinoma is more common than carcinoma. In fact, this is also a repeat question of FMG. Here the answer is A. Patient has situs inversus, sinusitis and bronchitis. What is it? Yes, it's a case of cartagenous syndrome. Okay, cartagenous syndrome. Hyperpigmentation of palm and soles. What do you think has happened? Batao. There's a lung cancer patient who has hyperpigmentation of palm and sole. What might have happened? Yes, it's a paraneoplastic syndrome by secretion of ACTH and which has caused this type of hyperpigmentation. Very good. The answer is B. To arrange the following sequence in correct sequence, क्या होगा? First thing is hemostasis, then inflammation, proliferation, and ultimately remodeling of collagen is required. The answer is C. Okay, I told you this already that men 1 में 3P and among the P the most common P is parathyroid. The most common tumor of the Pituitary is prolactinoma, and the most common tumor eh, of the pancreas is insulinoma. Okay, but do remember, if the question is most common enteropancreatic tumor in men 1, then the answer doesn't become the insulinoma, then the answer becomes gastrinoma. Okay. Acha. This patient has a sickle cell anemia and had a extreme pain in the legs. There was a right upper quadrant investigation shows sickle cells. What is the diagnosis? Obviously, इतना कुछ लिखा हुआ है sickle cell and then asking you, the answer has to be sickle cell crisis, right? The patient is brought to emergency room with a bee sting and has a sting with shock, respiratory failure, and vascular collapse. क्या हो गया इसको? Type 1 hypertension. So IgE mediated rejection very clearly. Okay, it has to be type 1 hypersensitivity reaction. ठीक है? The most resistant phase क्या होगा? देखो क्या होता है G0, G1, S, G2 और M, right? ये check point है यहाँ पर. ये check point here also ऐसे. Now देखो the most radio sensitive is this one. Radio sensitive ये वाला है. And this is the most radio resistant. So the best answer is S. Okay, S is the most radio resistant phase. May always solve this. Okay, so there is where we come to the end of the whole discussion, and I've tried to discuss almost I'll say 150 to 160 question discuss किया होगा हमने, and this whole PDF will be available in my Telegram group, which you can join by just typing Dr. Praveen's Pathology group. I'll just share in some time in this same group, and you can very well download it and use it for reference purpose for revising before the main exam starts. To ensure that you revise it multiple times, and for those who watch this live, I really thank you all for your valuable discussion, and we had the good interaction among ourselves. So just one thing, once the video is over, just put your comments in the chat box so that in case of any issues, in case you have any confusion, I can surely solve it for you also. Honestly speaking, I really loved interacting with you, all of you, and it was wonderful experience to again meet you all. I'm very sure you'll do very good in the upcoming exams. Just make yourself that motivation कि I have to do good, because देखो, success is not final, failure is not fatal. Courage is what helps you to continue, and just in few days remaining, just don't stop. Just ensure you read daily with a bit consistency. In case of any issue, we're always there to help you. We're just a message away. And just to message us, use my Telegram group and DM me. I'll surely reply to you, or use my Instagram handle of Dr. Praveen Ames. That's it. Dr. Praveen Ames. Simple type karo and follow me up there. And you can just message me in that Telegram group and in the Instagram also. So I would say surely that there would be not less than 20-25 questions in the FMG this year, and if your pathology is very strong, you surely will crack it with the best marks in this part only. With this, concluding this whole session was a 2 hour long session, I understand that, but I am very sure that we'll do very well in the upcoming exams. I'll just share this PDF in some time. Just give me some time to have dinner. I'll just then share it, but by the time, please put your valuable feedbacks into the comment box once the video is over, so that we can also interact for the days ahead also. Okay, take care, God bless you all, goodbye, and please do keep studying. With best wishes, here I'm signing off, and meet you in just some few days with the best result you can have in the upcoming FMG exams. On that side, I'll be basically meeting you to congratulate all of you, each and every one of you, and wishing you all the best. See you again. Goodbye. Okay.